Welcome back. This segment is brought to you by the Center for Plastic Surgery. Well, it is a way to smooth out the frown lines and get rid of those worry lines. You know, that big one on your forehead? Roxanne Cornelius from the Center for Plastic Surgery is here to show us how Botox works. Thanks for being with us today.
It's my pleasure to be here. Thank you.
Now, we have our own WZZM 13 volunteer, Pam Rankin, and we're going to get to her in a minute. We're going to be doing something live on the air. But first, I want to ask you a little bit about Botox. It's been out for a while, but not everybody knows exactly what it is and what it does. So explain to me exactly what Botox is and what it's normally used for.
Well, Botox is actually a purified protein. It comes from Clostridium botulinum, and it works to interrupt the communication between the nerve and the muscle. So if the nerve can't talk to the muscle can't move, and you can't make that frown line.
All right. Now, we've got some pictures that you brought along. One is of a Botox like done in the face, right?
Mm-hmm.
Okay. And this is the before and the after. So what are we seeing in the after?
What you're seeing in the after is someone actually trying to frown, trying to bring those brows together, and because of the Botox, they are unable to make that frown line in the forehead.
Now the next one we have is like kind of what we call like the crow's feet. So let's take a look at that picture real quick. Now this is the before and the after, and those are those little ones, the squinting right on the sides.
That's correct. Those lines that you see when you do a big exaggerated smile, or people that tend to squint a lot will form crow's feet, and by relaxing that area with Botox, you will find that those lines definitely soften, if not go away altogether.
Now how long, I guess I should say, does it last after you do the Botox?
Well, I think one of the most common misconceptions about Botox is that it's going to work immediately. It does not. It takes it anywhere from 3 to 7 days to start working. It will have its maximum effect at about 2 weeks, and then it will last for about 3 to 4 months.
Okay, gotcha. All right, let's talk about Pam here, because Pam has volunteered. Now, you've done before and after right here. You've done half of your face with Botox, right? Mm-hmm. And this was it last week that you did this?
Yes, Pam came in last Tuesday, and we did the left half of her face. We did some Botox in her frown lines, only on the left. We did Botox in her crow's feet, again, only on the left. And we did some filler only on the left side of her face. So she's here to have her face evened up today.
Now, Pam, since it's been since last week, have you noticed a difference?
Oh, yeah, definitely.
On the side? Do you feel like it's a little smoother? And you definitely noticed a big difference in the before and after a little bit.
Yes, definitely.
All right, so are you ready to do this on the air?
I am.
Okay, does anybody want to volunteer to hold Pam's hand?
If Pam will do a maximum frown, you can see her Botox is starting to kick in. Frown for me a little bit, Pam. It's starting to kick in. She's got movement over on this side, but she doesn't actually over here. And again in her crow's feet. Do a big cheesy smile. Okay, so you can see where her Botox has kicked in on that side. I have Pam has already signed the consent, so she knows what we're doing. So we've answered her questions, and we've gotten her wiped off ahead of time. So I'm going to have her frown again for me, Pam.
All right, ready, big frown.
We're just going to, and relax.
No, Roxanne, you can't get a running start with the needle.
We're just going to be real gentle here and put a little Botox in right there.
And how did that feel to you?
It really didn't feel anything. The needle is so small.
Does it feel like a little mosquito bite or like a little bee sting?
Barely even a little prick, so there's really no pain associated with it.
So just did that one right in there.
Yeah, Pam's pretty motivated.
All right,
frown again for me.
So we're going to have her do another one, and now Roxanne and Pam, they're both going to stick around. When we come back, we're going to take a closer look at skin fillers, how they work, along with some of the other benefits and the risks involved. So stay with us, please. We're going to be right back with more. Welcome back. This segment is brought to you by the Center for Plastic Surgery. You know, we've been talking this morning about some of the different ways to take years off your appearance. We just talked with Roxanne Cornelius from the Center for Plastic Surgery about Botox. Now we're going to take a closer look at fillers. Thanks for sticking around with us. And thanks for our volunteer, our own WZZM 13, Pam Rankin, for agreeing to do this. Now, we just talked in the last segment about Botox. She had the Botox done. And now we're going to be talking a little bit about fillers. And first, we have kind of like a little map, essentially, of where fillers go. Okay. Where do they go, and what exactly are the fillers? What are they used for?
Well, actually, the only FDA-approved area to put filler is in the nasolabial folds, or the smile lines that run from the nose down to the corner of the mouth. But we do use fillers in a lot of areas of the face. We'll put filler in cheeks, in lips, in noses, earlobes, chin, even in the backs of hands.
Oh my
So
goodness.
lots of places to put it.
Now, what are the risks that are involved with it?
Good question. Anytime I stick a needle in you, I put you at risk for bleeding, bruising, swelling, possibly infection, which I've never seen. But the side effects are generally temporary and will go down in a week or so.
And when you do the filler, is there any swelling or anything like that? I mean, do you have to
Initially there is. Yeah, you could see it in Pam's before and after photos that initially there was some redness and some swelling immediately after. Usually swelling goes down in 24 to 48 hours.
Oh, okay, that's
and
not
then
bad.
the product will suck water to itself. We're using Juvederm today in Pam's lips and in her cheeks. And it is one of the hyaluronic acid fillers.
All right, so are you ready to do this again? This is round 2 of poking things in Pam on air.
You can see the difference in Pam's upper lip where we have already injected
Yeah, I can
on
see it
this
like right
side.
above it, you know, just like some
a little
fullness right
fuller,
there.
a little bit smoother. So we're going to go ahead and inject here on the right. Now I should say that Pam was numbed up off camera. We did a dental block like your dentist would do for numbing up your teeth. And so she is nice and numb here. As you can imagine, injecting in the lips could be potentially uncomfortable.
I'm not gonna lie, I might be squirming over here, but it looks great, Pam. It's all good. Ow,
Get her wiped off.
So you didn't really feel anything with that much?
No, not at all.
Oh, all right, well, that's good then. Now, you said like usually it takes a couple days for the swelling to go down. How much before you? Well, I should say, how long does this one last now?
Any of the hyaluronic acid fillers will last 6-7 months depending on where we have put it and depending on the particular product and how much you are using. So it's a great product. Its hyaluronic acid is found naturally in our bodies, and so it's one of my favorites to use.
And tell me a little bit about, we're seeing a before and after picture. Explain this picture a little
Okay,
bit.
the before and after picture here, she has had some filler in her nasolabial folds and down along the corners of her mouth in what are called the marionette lines. She's also had some Botox, so she's gotten a nice eyebrow elevation from the Botox.
Excellent. Well, thank you guys very much, Pam. Thank you for being. Thanks for being so willing to do this. We appreciate it. Thank you very much, Roxanne.
My
We appreciate
pleasure.
your time today. You, of course, can find more information on the Center for Plastic Surgery on our website at wccm13.com. Just click on those Take 5 links. Right now, the Center for Plastic Surgery has a special offer just for our Take 5 viewers. Call 616-454-1256 or email www.grcps.com. Give them your name and your email address, and you're going to be receiving a certificate for $50 off your very first Botox or filler treatment. Certain restrictions do apply. You can find more details on our website under the Take 5 links. Well, coming up, she spent much of her childhood as one of the stars of the hit show Full House. When we come back, hear from Candace Cameron about her return to TV. Stay with us, please.